Today we are going to talk about the recurrent dislocation of the shoulder. That means if patient is experiencing the shoulder ball is going out as and when possible. This condition is called as a shoulder dislocation, and if these things repeat, we call it as a recurrent dislocation of shoulder. So first time when shoulder dislocates, it dislocates with its soft tissue along with it. So when shoulder dislocates, it kind of breaks the tissues or labrum, or we call joint capsule, in the front of the shoulder joint. So whenever shoulder dislocate, these things they fall down, and when we shift ball back into the socket, these things are still fallen there only, and they kind of adhere to that point. So next time whenever patient goes into this position, whenever he's trying to kind of hold a rod above, or he kind of trying to take something above his head, his shoulder goes in this position, and since there is no restriction in the front area, shoulder ball goes out. So if you experience such kind of problems, you might be a candidate of recurrent dislocation of shoulder. So if you have a recurrent dislocation shoulder, we do examine patient clinically, and there are specialized tests we do to diagnose the condition. Along with that, we order an X-ray and MRI of the shoulder. MRI will tells us about the bone loss of the shoulder and where is exactly the torn soft tissue is attached or adherent right now. Based on which there are mainly two types of the shoulder treatments available. One is arthroscopic Bankart repair, in which we make a teeny tiny 2 to 3 small holes near the shoulder joint, through one of which is there to put the camera, and another two are there to kind of help to fix up the tissues in the front on the glenoid bone, by which we kind of make a restriction in the front so that ball usually do not come out of it. Sometimes there is a big bone loss, and sometimes this initial surgery is not possible. Then we can do something called open surgery. We call it as a lethargic procedure. As you know, I have done specialization in arthroscopy and joint replacement. So in case if you have queries related to these kind of topics, like osteoarthritis knee joint for total knee replacement, for ligament injuries like ACL injuries, PCL injuries, multi-ligament injuries, or MCL injuries, or repeated shoulder dislocation or rotator cuff tear, or any problem in any joint related issues, you can always